It stops a chain of events that leads to changes in the cells, the abnormalities in the cells and development of cancer. So preventable but deadly. It's affecting the society and the economic growth also. They can modify your risk. They can increase the risk and they can decrease the risk. It may not show up any noticeable signs and symptoms.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Good evening, dear friends. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. As you are aware, this is a talk show with the expert doctors of Al Hilal hospitals and medical centers. Every year, thousands of women are diagnosed with cervical cancer, a type of cancer that is largely preventable and treatable when detected early. Today, we will be discussing about the causes, prevention and treatment options of cervical cancer with the specialist gynecologist from Al Hilal Hospital, Hamilton, Dr. Deepti Jagana. Doctor, welcome to the show.
Thank you so much for calling me. It's a pleasure to be here.
So, Doctor, can you briefly explain about cervical cancer and how it develops?
Cervical cancer is one of the most common cancers among women worldwide, and it develops in the cervix, which is the down and narrower part of the uterus connects with the vagina. So normally it starts with an infection. It's a virus infection called as human papillomavirus, which is most commonly transmitted through sexual route, sexually transmitted virus infection. This infection, usually our body tries to clear this infection through the immune defense mechanism, but sometimes when your immune defense mechanism is not that active, then the infection stays in your body, which leads to persistent infection. Over the period of time, like 10 to 15 years, slowly the cells become abnormal. These abnormal cells, they accumulate some genetic changes, eventually lead to cancer, that is the cervical cancer.
And Doctor, why is cervical cancer such an important public health issue in women today?
Yes, cervical cancer remains definitely important public health issue, especially when it comes to women. because of several key reasons. One such reason is due to huge global burden. Throughout the world, it is like fourth most common cancer among women, and second thing, it's a preventable but deadly. Because of lack of access, means most of the women, they don't have access to screening and vaccination, leading to preventable deaths. I mean, it's like more like 3 to 4 lakhs of deaths in a year only because of the cervical cancer all over the world, which is very sad. And the third thing, its impact on the family and society, because usually it strikes the women and in their mid 30s to 50 years, which are prime years for your family care and economic development and workforce participation. So because of this cancer, it's affecting the society and the economic growth also. The third thing, impact of public health and public awareness. Through vaccination and regular screening, we can prevent the cancer, we can reduce the mortality, we can reduce the death rates. In short, cervical cancer is very common and very deadly yet preventable condition.
And how common is cervical cancer globally?
Globally, it is very common. It's like when it comes to in general cancers, it is fourth most common. First one being the lung, and second one being the breast, and third one being the colon cancer. But like all over the world, there are huge regional differences. This is more common in low income and middle income countries like Asian countries, which reflects like the disparity of like influence of health inequalities on the incidence and mortality of cervical cancer.
Doctor, we usually hear about pap smear test. Can you make it more clear for us, and how pap smear helps to detect cervical cancer?
Definitely, it's a very good question, because this pap smear is very easy, very simple and quick test, at most effective tool in early detection and prevention of the cancer. How we do it? Usually we collect the cells from the cervix gently using a brush or a spatula, and it will be sent to a lab. It will be sent to the lab in a liquid solution, and there will be specialist in pathology. He'll be like examining under microscope and he'll look for the changes in the cells. These changes are usually caused by the virus, and like how it helps. This pap smear, first it can detect the changes much earlier, years before they can turn into cancer, they can develop into cancer. And second thing, this when we detect early, at an earlier stage, it's easy to treat. I mean, we can remove the abnormal part of the cervix, we can totally prevent the cancer. And the third use is monitoring. By doing regular pap smears, these pap smear tests help track those abnormal changes over time and ensure any problems are detected on time.
And doctor, how often should women get pap smear done, and around what age should they start?
I think it's a very important question. There are so many guidelines, like when to start the pap smear, how frequently we have to do, but usually what we follow is RCOG UK guidelines. Ideally, women should start doing pap smear when you're 25 or when you're sexually active. So it is recommended to do every 3 yearly in between 25 to 49 years, and from 49 to 65 every 5 years, are more frequent depending on your clinical situation, depending on your clinician orders. And it is recommended that by doing combined test, pap smear along with the HPV test, every 3 years or every 5 years, it will be like more effective in detection.
And doctor, coming to vaccination, can you explain about the HPV vaccine for us?
Yes, HPV vaccine plays a crucial role in preventing the cervical cancer. It works by stopping the infection, which is the commonest cause of the infection. It stops a chain of events that leads to changes in the cells, the abnormalities in the cells and development of cancer. And it should be given before getting exposed to the human papilloma virus. Means ideally it should be given before when someone becomes sexually active. And it is recommended that 2 doses of vaccine should be given for both girls and boys at as early as 9 years. And yes, 9 years. And it can be given to the adults up to 45 years. And why to boys? I think because this vaccine causes cervical cancer in women, but it can cause several other cancers in men too, like anal cancer and penile cancer and oral cancer and some other things like genital warts.
Doctor, can lifestyle factors influence the risk of developing cervical cancer?
While persistent infection with the human papillomavirus, that is the most common cause for the cervical cancer, but there are certain lifestyle changes and health behaviors. Definitely, they can influence your risk of developing cancer. They can modify your risk. They can increase the risk and they can decrease the risk. Like smoking, tobacco causes abnormalities in the DNA and it decreases your immunity. So it makes hard for our body to clear the viral infection. And the second one, having multiple sexual partners and having sexual activity at an earlier age, it increases like your exposure to the human papillomavirus and leading to the persistent infection. And the third thing is poor diet and nutrition. Obviously, it affects your immune defenses. And the fourth thing, lack of awareness and lack of access to the vaccination and screening, it leads to detection of the cancer at a later stage where treatment is highly impossible. And the one more and other important thing is using birth control pills. Most of the people, they use birth control pills without any supervision. And there are a lot of studies that say that if you're using birth control pills more than 5 years, there is slight increase in the risk of cervical cancer. But the good thing is this risk comes down when you stop taking medication. And there are some protective factors also when it comes to lifestyle, by following regular screening and taking vaccination and quitting smoking, and by using medication, especially hormonal medication, under supervision, and by following safe sex practices, and by taking regular healthy diet and following exercise. Definitely it can improve your immunity and your body defense mechanism. In general, it can prevent cancers.
And Doctor, how can media and community programs help in spreading awareness about cervical cancer?
This is very good question, because media and community programs, definitely they play very important role, especially when raising the awareness about this pap smear and about prevention of the cervical cancer, because media can reach wider audiences and you can change public attitude. You can normalize the screening and you can reduce the fear and stigma, and so many people they'll get to know that yes, we have a cancer which can be preventable, and everybody gets to know that there are screening services and there are vaccination. So media and community programs definitely play an important role, and for provide mainly by providing access.
Doctor, now can you speak about the early signs and symptoms of cervical cancer?
As it's important to understand signs and symptoms of early cancer, so that you can identify and you can seek out medical care, and which will definitely improve the treatment outcome. But unfortunately, this cervical cancer may remain silent in early stages. It may not show up any noticeable signs and symptoms, but as the disease progresses, there'll be some signs and symptoms. More importantly, altered bleeding patterns, like bleeding in between the periods, and bleeding after sexual intercourse, and bleeding after menopause. And there are some other changes like altered vaginal discharge. If you're having more watery discharge, which is foul smelling, and if there is a tinge of blood, or if you're having dull pelvic pain or pain in the back, pain in the lower abdomen, which is not at all related to your periods. If you ever notice any of these signs and symptoms, should not be neglected. Immediately should get evaluated.
Is cervical cancer hereditary, or is it caused mainly due to infections?
I think it's a very important question, because it's important to understand who are at risk of developing this cancer so that we can work on the prevention. It's not usually hereditary, and it's very rarely passed down in families, because there are no strong genetic links as we see in other cancers like breast cancer and colon cancers. But if you have a family member having this cervical cancer, then there will be a slight increase in risk of developing cancer. Why? Because not because of the genetics, but because of the shared lifestyle and environment and health behaviors like smoking, lack of access to the screening and vaccination. But the main important reason for this cancer is the virus infection, which is caused as human papilloma virus. There are more than 100 subtypes, but there are few subtypes which we call high risk subtypes, which is associated with development of this cervical cancer, and it can cause some other cancers too, like penile cancer in men, and anal cancer, and oral cancer, and some other benign things like genital warts.
Doctor, what is the key message you want the viewers to keep in mind after this discussion?
To all the women out there, cervical cancer is very common and deadly yet preventable. But the prevention starts with you. Schedule your pap smear and HPV testings regularly and get vaccinated. Early detection is the key. Protect yourself and the ones you loved.
And finally, Doctor, what do you have to say about Al Hilal Healthcare Services? What are the services you offer in your Hamilton branch?
Definitely, Al Hilal is the fastest growing and largest healthcare service in Bahrain, and we provide accessible and available healthcare services to everyone. I'm happy to be a part of Al Hilal Healthcare Services. I'm available regularly in Hamilton branch.
So thank you, Doctor. Thank you very much.
Thank you so much for inviting me.
It's a pleasure. So to all the women watching today, mothers, daughters, sisters and friends, always remember your health matters. Get pap smear done and prevent cervical cancer, because prevention is always better than cure. Till we meet again in a new episode with a new doctor and a new topic, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.